Hey guys, James here. Welcome back to Untitled Chiropractic Australia. Today we're going to review sciatica. It is an extremely common problem which we manage in our chiropractic and massage practice. So, a really common question which I'm asked is, where is the sciatic nerve? Well, anatomically, the sciatic nerve originates from your L3, 4 and 5 vertebrae, and these three nerves transition through the lower back and deep into the buttock area and then down the leg into the lower leg and foot area, and that does that on both sides of the body. Now, if you're experiencing sciatica, you may notice pain anywhere along this nerve distribution. So a lot of people commonly report that they notice lower back pain or lower back stiffness. You may also report referred buttock and thigh pain or posterior thigh pain which extends down the leg. Now, you may also notice that it's quite a burning sensation. You may report some numbness or tingling in the area and potentially some muscle weakness as well. Now, it's also important to recognise that there's various clinical conditions which can mimic sciatica. So you may be feeling like you have sciatica, but essentially you actually don't. So some of these conditions which we see, firstly one's called Piriformis Syndrome. Piriformis is a muscle which is deep in your buttock area, which may pinch the sciatic nerve. We also may have what's called a facet joint problem or a sacroiliac joint problem. Again, they can mimic signs that you're experiencing sciatica, but you're not really suffering from sciatica. So therefore, it's really important that you have a proper assessment from a chiropractor or physiotherapist or whoever you want to see, so that they can assess you. They'll perform various orthopedic tests, whether it's assessing your range of motion, palpating the general area, performing various tests to rule out serious pathology, so that they can determine exactly what the problem is and therefore what management you require. Now, if you choose to see a chiropractor, some of the general techniques which you can expect to receive when you see a chiropractor would be lumbopelvic joint mobilization or manipulation. So essentially that's when you go see a chiropractor and they crack your back. This technique helps to improve joint movement or joint function. It will also in turn reduce muscle tension or spasm and therefore reduce pain. We also may perform various soft tissue techniques such as massage, dry needling, acupuncture, stretching. Again, this will reduce muscle tension and therefore pain and potentially irritation on the sciatic nerve itself. We may prescribe you some exercises to do at home. Early on in your rehabilitation, these exercises will most likely be aimed at improving flexibility and mobility. As you progress and as you recover, these exercises will be more so targeted to strengthening various muscles to improve your symmetry and balance through your lower back, core and lower leg region. So there's some of the techniques which you may experience. If you'd like any further information about sciatica or problems associated with the lower back, feel free to please give us a call. Our phone number is 1300 003 777. Alternatively, have a fantastic day and we'll talk to you soon.